Welcome back to the second part of Reimagining Childhood, a special symposium organized by the World Innovation Summit for Health, WISH, and UNICEF on the occasion of World Children's Day 2020. I'm Rawa Oje, and I'll be presenting the second panel of the day for a topic that is very dear to my heart. In an ideal world, this conversation wouldn't be necessary and wouldn't be happening. In an ideal world, children are loved, and I should add, in the healthiest form of love. They are cared for and protected. In the world we dream of, we give them the best of us so they could bring the best future for all of us. But unfortunately, millions of children grow up exposed to different forms of violence. Discussing a public health approach to addressing violence against children, I have with me Dr. Najat Maallamjid, the United Nations Special Representative of the Secretary General on Violence Against Children. I also have with me Professor Carlos Javier Aguilar from UNICEF, Regional Advisor on Child Protection at the Regional Office for the Middle East and North Africa in UNICEF. We have also Professor Dame Caroline Hamilton, Director of International Programs and Research at Quram Children's Legal Center. And I have with me in the studio Ms. Najat Abdullah, Director of Family Affairs at the Ministry of Administrative Development, Labor and Social Affairs in Qatar, and Ms. Mariam Al-Misned, Executive Director of DREAMA and Aman Centers for Qatar Social Work Foundation. Feel free throughout the panel to send us your questions and to whom you would like to address it. We will try to make this conversation as interactive as possible. Then we will move to your Q&As. So make sure you send us your question as soon as it comes to your mind so it will be ready for the time we will ask it. We will start with the UN SRSG on violence against children. Ms. Maallamjid, this year Children's Day comes with a message that we might be masked, but we won't be muted. What should we pay attention to this year?
Yes, I would like, if you allow, to begin by thanking the organizer of the World Innovation Health Summit and UNICEF for arranging this day devoted to children at Summit and including this important session on the protection of children from violence. I am really delighted to join you. As we commemorate today the World Children's Day, I want to begin by recalling that all children have the right to live free from violence as enshrined in the Convention on the Rights of the Child, the most widely ratified human rights treaty. As you know, violence has a huge economic and human costs for society and hinders national development. The 2030 Agenda for Sustainable Development recognizes the need to address this challenge and has a key target, 16.2, to end all forms of violence against children. And yet, despite this commitment, the lives of millions of children are surrounded by violence each year. Children are victims of violence in the places where they should feel most secure within their families, schools, and institutions for their care and protection. And they are now increasingly threatened in the online spaces they use to learn and socialize. Although many countries still do not collect regular data on the scale and prevalence of violence across the world, up to 1 billion children are estimated to be subject to some form of physical, sexual, or psychological violence every year. That's half of all children. There is a problem of sound, I think, because there is an echo.
Any problem? We hear you very well.
Thank you. According to the Global Status Report on Preventing Violence Against Children, jointly published by WHO, UNICEF, UNESCO, Global Partnership to End Violence Against Children, and my office in 2020, nearly 3 in 4 children, or 300 million children aged from 2 to 4 years, regularly experience violent discipline by their caregivers. Approximately 1 in 4 children aged under 5 years live with a mother who is a victim of intimate partner violence. 1 in 5 women and 1 in 13 men report having been sexually abused as a child aged from 0 to 17 years. Globally, emotionally abuse prevalence is estimated to 363 per 1,000 children aged under 18 years, or just over one in every three children. According to UNESCO Behind the Number report launched in 2019, bullying, including cyberbullying, is widespread throughout the world, affecting more than one in three students between 13 and 15 years of age. In 2019,
Mm.
nearly 70 million child sexual abuse images and video were reported to the US National Center for Missing and Exploited Children. That represents an increase of more than 50% in the previous year. According to UNICEF June reports, around the world, 650 million girls and women alive today were married before they were 18. And in the developing world, one in nine girls is married before they turn 15. Yet, even this number do not give a full global picture and are likely to be an underestimation of the magnitude of the problem, as reporting and monitoring systems are weak and challenges exist in data collection in many parts of the world. Ladies and gentlemen, the challenges of ending violence against children were already immense before COVID-19 struck. The direct impact of the pandemic, as well as mitigation measures taken, are putting us even further behind. Unprecedented global crisis due to the pandemic worsened already worrying situation for the most vulnerable children. What began as a health crisis risks evolving into a broader child rights crisis, in the words of the United Nations Secretary General. This pandemic and its mitigation measure have increased the risk of children to experiencing or being exposed to violence at home due to school closure, confinement, movement restriction, disrupting provision of already limited child protection services, added family stresses related to job isolation, and anxiety over health and finance. 1.8 billion children live in 104 countries where violence prevention and response services have been disrupted. In addition, widespread digitalization and increased unsupervised online internet use has magnified issues around sexual exploitation and cyberbullying. Children who are already vulnerable, including the poor, minorities, indigenous, refugees, migrants, children living on the streets, internally displaced children, disabled children, children deprived of family care and deprived of liberty, children living in conflict affected areas are more at risk to be victims of violence and exploitation. The stress and uncertainty associated with the COVID-19 outbreak has significant negative effects on children's mental health. In various consultations with children, children express that they feel unsafe, insecure, scared, lonely, and isolated. In addition, the mid and longer term socioeconomic crisis caused by the pandemic will increase child poverty. Less than a year, the COVID-19 pandemic has had a devastating impact on the global economy, triggering the deepest global recession in decades, including estimates of up to 150 million people being pushed into extreme poverty by 2021, affecting mainly women and children. As poverty is a main driver, the risks of child marriage, child labor, child sexual exploitation, and child trafficking are all increases, as is child enrollment in criminal armed violent extremist groups. Ladies and gentlemen, as a pediatrician myself, I know the harm that violence and stress can cause to children's physical, mental, and mental development at any stage of their life cycle, be it in early childhood, infancy, or during adolescence. Violence against children has lifelong impact on health and well-being of children, families, communities, and society. Children exposed to violence are more likely to drop out of school, have difficulty finding and keeping a job, and are at heightened risk for later victimization and or perpetration of interpersonal and self-directed violence, setting up a vicious cycle of intergenerational transmission of violence. Ladies and gentlemen, children's protection from violence is gaining increasingly recognition on international, regional, and national agendas, leading to the development of national plans, legal reforms. But many challenges remain. Global Status reports on preventing violence against children found that laws against violence affecting children are widely enacted but often inadequately enforced. Many countries have some mechanisms to support national violence prevention work, but few have plans that are fully funded and include measurable targets. The report found also that 89% of countries allocate responsibility to multiple sectors for addressing violence against children with the education, health, justice, and social sectors most often mentioned. And 80% of countries reported having at least one national action plan to prevent violence against children. These promising findings contrast with the fact that just one-fifth of countries reported that their national action plans are fully funded, and despite most countries having some nationally representative prevalence data, just 21% reported that they have in place quantitative baseline and target indicator by which to monitor the effects of their effort. Ladies and gentlemen, there is a strong need to act together, better and faster, through an effective and efficient child rights centered, cross and multi sectoral approach. I am a firm believer that a public health approach to ending violence against children is the surest way ahead. The public health approach to violence is based on the rigorous requirements of the scientific method. In moving from problem to solution, it has four key steps. One, define and monitor the problem. Two, identify risk and protective factors. Three, develop and test prevention strategy. Four, assure widespread adoption. The public health approach provides a useful framework for both continuing to investigate and understand the causes and consequences of violence and for preventing violence from occurring through programs, policy intervention, and advocacy. Public health approach draws on a science base that is multidisciplinary and cross-sectoral, including health, education, social services, justice, policy, and the private sector. The public health approach uses the four-level social ecological model to better understand violence and the effect of potential prevention strategies. This model considers the complex interplay between individual, relationship, community, and societal factors. This approach is more likely to sustain prevention efforts over time than any single intervention. In adopting a public health approach, we must equally stress that in the long term, prevention is a more effective, efficient, and sustainable approach than responding to the after effects of violence. Ladies and gentlemen, we must ensure that in the immediate response to the pandemic and in the rebuilding, child protection is recognized as a life-saving and essential service along with health, mental health, and education. We must recognize the links between strong social protection system and effective child protection. In many countries, these systems were inadequate before the pandemic, and we must seize the opportunity of recovery to build back better. We must recognize that allocating budgets and strengthening services for the well-being and protection of children from all forms of violence is an investment in the future and will be key to the recovery phase as we build back better. This cannot be done without children's perspectives and views and without involving them as part of the solution in the immediate and recovery phase of this pandemic. Ladies and gentlemen, we already have some good foundation to build on. The United Nations Secretary General has issued policy brief on the impact of COVID on children, on mental health, universal health coverage, with strong recommendation on how to strengthen system recovery. He has also called for a global ceasefire on domestic violence. We have also the 2030 Agenda for Sustainable Development and a comprehensive set of targets that address the strengthening health, education, social and child protection system and the gender and economic inequality that are the drivers of violence. The 2030 Agenda has led to a mobilization of global alliances, coalition and partnerships that are working together to accelerate implementation. We must ensure that the financial resources being mobilized to support recovery are also directed towards the health, education, social protection, and child protection services that are essential elements to ending violence against children. Ladies and gentlemen, today we commemorate the World Children's Rights Day. It is an opportunity to say for a strong mobilization of all key stakeholders, including children themselves at global, regional, and national levels to keep the promise of the 2030 Agenda to end the pandemic of violence against children, leaving no one behind. Thank you so much.
Thank you, Dr. Ma'alla Mjid, and we join you in calling that the COVID-19 impact should not stop or delay the fight against other pandemics such as violence against children, and should not delay the plans of 2030. Dear panelists, as we have heard from the SRSG, the data on this globally is still staggering despite all the advances made around the world in medicine, human rights, laws, social welfare. So why is this pandemic still persisting in our homes, schools, communities and societies? And in the information age, what is different about the violence children are experiencing in our societies? I will start with you, Professor Hamilton. What's your take on the matter?
Thank you very much. I thought that was an extremely inspirational speech, and thank you very much, SRSG. In a way, that is the macro level that we've heard about, with all the different action plans and the agendas and the different organizations and their publications. Looking at it at a slightly different way, perhaps from the more micro level, the state level, we know that in practice it's difficult to put in adequate systems to address what, as you very rightly say, is a pandemic of violence against children. And it takes a very determined effort by the state, by the community, and the involvement of children to really address issues of violence. We know, for instance, that it's the experience of many states that health systems play an extremely important role in child protection. They're often the first to see signs of violence or abuse, of physical injury or failure to thrive or behavior problems. But that doesn't seem to translate into real protection for children. And the question is, well, why not? Well, we know that very often families have a right to privacy in health providers' eyes. They don't want to intervene and interfere in what are seen as family matters. Or they feel bound by confidentiality and feel that they can't respond. Or they don't know how to respond. There are no referral protocols in place, and health officials are not sure who to report to or how or when. And of course, a lot are not good at listening to children, at picking up the cues, at understanding what they're saying. And there's not a great understanding of family dynamics and the psychology of abuse. So what to do to address those factors? Well, UNICEF has taken the view that you need a multidisciplinary approach to child protection. So we know that we need laws and regulatory frameworks and policies, and that I think the international bodies have been good at. But we also need effective governance structures in countries at central level, at regional level, at local level. We need a continuum of services. We need to be able to support families and help them to use positive discipline rather than physical discipline. We need services for children who cannot stay with their families because the violence is just too bad. We need standards, and we need someone who inspects the system to make sure everybody's doing what they should. Money is essential. You cannot have a child protection system on the cheap without putting any money in. It's not possible. And we need financial and we need human infrastructure. We need social participation. The community has to buy in to child protection. They have to accept that children do suffer from violence and that this needs to be addressed. And we need to listen to children. And we need all those different bodies, whether it's health, whether it's education, whether it's justice, or whether it's social welfare, all to come together. All needs to come together and act in coordination to provide child protection. And we need referral mechanisms, we need national children's rights bodies, we need these bodies to ensure that these protective elements are in place. So you can see it's really a complex system if we're going to put together adequate child protection. Just putting those elements in place also won't necessarily do the trick. And we see a lot of instances where individuals or communities are really running their child protection system, but what we need is to professionalize the system. We need to train public health officials. We need to train social workers. And that means having university courses, having readily available training, making sure that social workers are adequately paid, adequately trained. All of these issues. And I think coming back from my perspective, having worked on child protection systems in many countries, it's not easy and it's not a short-term fix. That as we start on this journey, as the SRSG has reminded us, we've got 10 years before 2030. How can we fulfill that agenda? And I think it needs an enormous practical push to get systems in place and to start operating them so that our children can really benefit from child protection, both in terms of prevention and in terms of response when it happens, and enable them to realize their potential and have the future that we would all wish for our children. Thank you.
And I guess we can also work on public awareness as well, especially in countries like in the Middle East, where we like to meddle a lot in the affairs of others. But when it comes to stopping an abuser from hurting a child, we usually shy away and say it's none of our business. Let's make it our business and let's consider all children our children. Mr. Aguilar, what's your take on the staggering numbers that her UNSRSG mentioned?
Very good afternoon, and thanks a lot for creating this space for such an important topic. And I could only agree with what was already shared by the SRSG and Caroline. Maybe a few things. I would like to concentrate on where we think we can make the difference. We have many ideas, many possible solutions, but let me share what we have learned in UNICEF globally, and especially in the Middle East and North Africa region. We have at least, let's say, 5 ingredients if we want to make a change in the lives of children. And those ingredients have to come together. The very first one is the political commitment. The second one is really the capacity to deliver prevention and response services. Then a supportive public opinion, practical solutions to help parents, communities, and then finally generating evidence that what we are doing is working. In the real world, all those 5 ingredients rarely come together. And I think the challenge we have now is to bring all these 5 elements and more as one. So let me go one by one on where we think we can make the difference in our region in the Middle East and North Africa. We already have a number of solutions. We need to do more. Surprisingly, COVID has created an opportunity, a moment of reckoning, where we see violence is not something that is happening remotely in the street at the hands of a stranger. Violence is happening in our own homes, in our own communities. So we're in an interesting moment of reckoning. So the first element we need to work together to make a change in the lives of children and young people is that political commitment. So what is happening in the real world is that when we present evidence to political leaders, they cannot believe the data. Even when we show data, the most scientific data we have from public health models, they don't believe that this is possible. There is still a certain level of denial, with a few exceptions. I'm not pointing out specific countries, but the first is really recognizing that violence is not something that is happening remotely, it's something that is happening in our own communities. What we observe as something critical here is that there is not yet a recognition that preventing and responding to violence against children is part of that moral minimum package that every child deserves. So protecting children is not as important currently as education, primary education, and health. So it's not competing priorities, it's priorities that need to come together. What we observe surprisingly is that when political commitment starts, is when the public opinion, the civil society, religious leaders are pushing our political leaders to do something. Maybe it's not the most effective way, but in real terms, we need to be aware that political commitment is not as scientific as we want to be. It is based on how the public opinion can generate a change and to say violence is unacceptable. The second one is the real capacity to deliver preventive and responsive services. So what does it mean? In a region and globally, there has been an overemphasis on legislation, which is important. It's very important to have good laws. But legislation alone won't be a solution. What we need is to make legislation implementable. And Caroline already mentioned what does it entail. You can have the most beautiful legislation, the most perfect piece of law in the world. If you do not have social workers to respond to the needs of children, if teachers in schools do not want to contribute to keeping children safe, if parent behaviors do not change, it doesn't contribute to any significant change. What is important here then is really whenever we think legislation is about changing behaviors and making services available. This is about budgets, this is about costing, this is about really the capacity to deliver and the leadership of public institutions to do that. Without collective action, there will be no solution. Then, very important as well is that many times, as you already mentioned, is the public opinion sometimes is endorsing violence as something normal and educative. And this needs to change. What we have learned in the very hard way is that very expensive and multi-year public campaigns are not enough. We need a real dialogue with communities, with parents, religious leaders to show that there are ways to educate children without violence. We also need to make that important shift in which we recognize that in our own homes, violence is happening. It's not an exception, but it's something universal in the lives of children. But then there is the fourth element, which is practical solutions. In some countries, we have political commitment, we have institutional capacity, but political leaders tell us, but what is the solution? Explain me what are the solutions. We have some of those global solutions now based on evidence. This includes helping parents and improving the way they raise their children, how they interact with their children, how they bond with their children. It takes a lot of time, but those solutions work. Big question mark is we need to make them work at scale, not for a few hundred children, a few thousand children, but for millions of children. The aim should be universal. Same applies to keeping schools safe, which has an impact on learning, economy, but also on the well-being of children from a mental health perspective. So if we are not able to propose those solutions to political leaders and public institutions, such as keeping schools safe, parenting programs, keeping children safe online, those solutions do exist. But I want to insist on to stress the fact that without that being at scale, there will be no proper change. And finally, my very last point in 10 seconds would be that we should be able, and this is what we need to learn from the public health models, we need to be able to generate evidence on what works at scale. The public health models have been able to quantify issues, demonstrate solutions, and rectify things when they do not work. I will stop there for the moment and really very keen to pursue this conversation, and thanks a lot for creating this space. Thank you.
for sure. And I will take this question to Ms. Abdullah, who will be answering in Arabic. So I will address the question to her in Arabic. لقد تحدثت الممثلة الخاصة للأمين العام للأمم المتحدة عن أرقام مرعبة ما زالت تتفاقم حتى مع السنوات، وخصوصا هذا العام مع وباء كوفيد 19 في العالم وليس فقط في العالم العربي. هناك ارتفاع في العنف المدارس، هناك ارتفاع في العنف الذي يتعرض له
violence in schools, in violence on the internet, and there is still family violence which is still existent and has increased in compared to the past years, despite all the legislations that have been adopted in all the countries. In your opinion, what stops any real change? In the name of God the Merciful, I would like to thank you to inviting us and to invite the Ministry of Administrative Development and Labor and Social Affairs to this conference. Any change requires efforts, concentrated efforts between the different parties concerns. Violence has increased, and we know that it is related to the COVID pandemics. COVID is a source of pressure on families, but if we all, governmental, civil society organizations join forces with the families, if we collaborate, we will come out with major solutions to this problem. However, this requires time. There are many challenges, but with common efforts, we can face the situation and protect the children in all fields. As you have said, all the parties, from the legal viewpoint, the administrative viewpoint, we all have to work together in order to suggest solutions with the support of the civil society, and we have to work hand in hand with the families as well. And we do hope we will find solutions. In our Arabic societies, the families are those that oppose such legislations because they consider that is an intervention in the affairs of the family. How can we change this viewpoint in families, and how can we work with children that are part of society as a whole? Culture, education is very important. We have to do educational awareness before marriage, not only at a restricted period of time when people have children. No, before marriage, people have to be educated and made aware of the problem. We have to take specific steps before marriage, during marriage, when children arrive. We have to train people and make them aware of the problem. I speak for the state of Qatar, and the majority of families are educated, and we have families that try and find solutions to the problems of education, how they deal with children, how man should deal with his wife, what is the relation between men and women. And I believe that we are today in a more peaceful situation. All parties have tried to develop their programs through the internet, using information technologies more and more, and have found solutions. We now can pass on the messages to all houses, to households, and we use today the virtual world more and more. So the information reaches every household and everyone is informed. The Ministry of Development, before and during the pandemic, has cooperated with many stakeholders in order to see how to work from a psychological viewpoint, from an educational viewpoint. How does the family react with children? How do members of the family react with one another? How does the men in the Gulf society behaves? And today there are really progresses. Not only in the Gulf, the presence of men in homes could be a problem, not only in Gulf countries.
For those who didn't get the translation or who are not Arabic speaker, Ms. Abdullah said that first, any real change still requires some time, but mostly requires collaborative efforts from this family itself, from the governments, from the legislative part. So I allowed myself to follow up with her and ask her about the resilience and the resistance from families, especially in the Middle East and North Africa region, towards any laws to protect children, as they feel that this is intrusion inside the family. And how can we move to a society that considers children part of the society as well, and not only private parts of the family. So she mentioned that this we are witnessing now with the higher level of education of new couples. We are witnessing better understanding and better relationship with the children, with also better dynamics within the family itself. And that during COVID-19, the ministry launched a lot of awareness campaigns of how to deal with the stress of COVID-19, how to deal with the stress of lockdown, and how to make the environment within the house more friendly and less stressful for everyone. Ms. Al-Misnad, this takes me to you. You're working in DREAMA, also the association that helps children and that protects children within Qatar. I go back to you with the original question to all panelists. Despite all legislations and the presence of centers like yours, what's stopping a real change in child protection?
For a start, thank you for inviting me today, and good evening for the people who are in Qatar, and good morning for those who are around the world. If we speak about the child protection in Qatar, let's say, as an example, since we're working here in Qatar, all the things that my colleagues just mentioned, having a national strategy or having the system sorted, or the protocols, having the needful fund there to establish this system, I think all of these things are very important. But let's give an example of having a qualified hospital with all the equipment that everyone needs, but not knowing about it or not trusting the system or this hospital. So I think that we have the strategy and we have the system there and we have the norms and the laws. But no matter how much effort that we put into these things, unless the children and the families trust us and they can come up and speak up about their problems, regardless of the social stigma. I'm not saying that we don't have social stigma. We do have social stigma around this topic, especially in the Gulf and in Qatar. Families tend to be scared to talk about it. Even the children are scared to speak up and say that, yes, we've been like going on under violence, or we're being abused. I think it's not something easy to talk about, but not talking about it will not make it go away. So I think that we should focus on raising awareness, advocacy programs that will help changing the mindset of the society. And then we can work together to improve also parallelly on the system that we have. This is my humble opinion from practicing child protection within the Amman Center.
Question going to you, Ms. Al-Misnad. As a practitioner and frontline organization, what do you see being done to strengthen child protection in Qatar?
Actually, having the Ministry of Social Affairs here working all the time on providing better understanding on the law and the policies that we have here in Qatar is a very important key success factor. Also, having Amman Center out there, reaching out to people, telling them that we're here, having a hotline that helps women and children 24/7, with all the facilities and all the let's say the resources that we have, is a very important success factor, as I said. Keep going on and building on this. I think that, as I just mentioned, that raising awareness is very important on what we have. So I'm not sure if this answers your question, because actually the voice goes and comes back. So if you can just tell me if this is what you asked me for.
The question. I'll go to Dr. Maalla Mjid. Where has most progress been made to be positive?
It is a very difficult question, because we highlight that we need all the key actors involved together. I think, very frankly, you have good positive examples. You know, if you took a kind of pilot project, when you have wonderful things that are going on, when you see the Ministry of Justice legislation, a national policy with budget, you know, having a big program regarding raising awareness, empowerment of population, working within education, within health, within social affairs, justice, law enforcement. The main problem, and in many, many countries, even in the developed countries, the big problem is that they are not enough scaled up. They are not also based on sustainable approach. And the main problem is really regarding the fact that we don't monitor very well the impact of that. Why? Because you have the problem of information. And as highlighted by Carlos in the beginning, you know, regarding also currently, we were just within my office reviewing all the voluntary national reports and seeing how countries are reporting on, you know, the SDGs, and you have many SDGs that are related to violence. You have few numbers regarding, you know, violence. You have more about the responses than violence. It is really due to one, the denial in some points, because some countries doesn't want to have huge number because it seems that it's not good. And at the same time, it's a problem more about, you know, definition, clear definition, sharing information. I am coming from Morocco. When I try to have information regarding the scale and the magnitude, I have to look within the Ministry of Justice. They have their own definition. Ministry of Health, they have their own definition. Ministry of, and this is very, very difficult, really very, very difficult. And also because it's still underreported. We have few child-sensitive and complaint mechanisms. That, and as was highlighted also by Miriam, the problem is also how children can trust in law enforcement agency. And it's not a primary reflex to go to the police station and tell I was, and also because of social perception and behavior, not only among, you know, families and communities, but also among those who are delivering services, judges, law enforcement agencies, and we need to change that. This is, and it takes time. It's not only a public awareness raising campaign, it has to be really for a long time. I want also to tell the countries where we saw, it's when they have this kind of multi-platform services, one kind of one-stop services that are not only based in the capital, but based at local level. This is very important. And you have all these services, social, protection, education, justice, parenting, and so on, you know, in one platform. It could be held in the hospital, it could be put in one NGO, it could be put, the location is not important. The standardized approach is very important. And this, I think, we need to go more on that, because what we saw, each ministry is developing his own. What we need, we know what is working, what works. We just make sure that we need to standardize that and to put it within, you know, at local level, within the service or the institution, really, that it's present, and to build on the existing mechanism, and to link between formal and informal mechanisms, because you have some informal. I am coming from an Arabo-Islamic, you know, background, and we have also in our values and in our tradition strong protection. And I think we need not to fight only the bad, harmful practice, social norm, but also to increase the wonderful, protective norms. And this is important. And it's very sensitive because, violence against children is really very linked to violence against women. And this is also important to work on these gender stereotypes and so on. And I just want to come back to one point that was highlighted by, if I remember well, Najat, because she has the same name than me, who is the director of family. I think the main point is also to make sure that it's not only the Ministry of Social Affairs who is dealing with that. This is a big problem worldwide because Ministry of Social Affairs in many countries, even in mine, is dealing with all the problems. And I think really it's important when we are speaking about child protection, it has to be really a national, commitment within the top level, This is important. The Ministry of Social Affairs has to coordinate it, to work on it, sure, because we need to involve Ministry of Justice, Ministry of Education, all the ministries, and Ministry of Finance, because this is important. Another good positive, experience you have in some countries, they did cost effectiveness of investing in child protection / social protection. And for example, the most recent one is Iceland, who did it very well and really showing, and previously many countries did it. I think we need to show that by investing in child protection within this approach really is very important. We will have a new return on investment and it will impact, the economic growth and human growth. And I think one point, if you allow me, that is very important. We are not experts. I am speaking for me. Children are experts because they know better than us and we need to listen to them. It doesn't mean only an exhibit show. It's really to make sure participating in the process. And it doesn't mean that we are, having this fight in many countries, even in mine, that when you are allowing children to express, to provide information, to be involved in implementing, and I had no time to highlight it during my presentation, but before and during the COVID, the number of child-led initiatives, even in the Arabic countries, are increasing. They are doing peer-to-peer initiative, raising awareness, informing, providing peer-to-peer support. And I think it's really important to see them as an actors really of positive change. And it doesn't mean that family is going to lose its power. This is very important by building dialogue, and also positive discipline by empowering families and communities. It's really important. We cannot end violence against children only by tackling, children who are victims or at risk. We need to build a safe, nurturing, empowering and protective environment. And it means working within the community, working at grassroots level, working with families. And another point I think that we need, if you want to push more, we have many champions in the United States, and to make sure that they are owning the process, because it's not only speaking. I think it's really important to highlight this good initiative and to tell it's possible, because we have the evidence base to tell it. Over to you.
On the contrary, like you mentioned, it's not breaking the family. On the contrary, it's strengthening the bonds between family members. I interviewed recently an abuser who now his children don't talk to him, and he just wishes that someone intervened differently when he was beating his own children, because he would love to have a relationship with them. So definitely it's saving the family, saving the whole structure of family by having a proper intervention, good intervention. سيدة عبد الله، أخبروني أنه هناك ترجمة، لست بحاجة لأن أترجم كلامك. كان لديك تعليق على ما قالته الممثلة الخاصة للأمين العام.
About the representatives of the Secretary General, I wanted to add the following. Today, within the Commission in charge of women and children and handicapped people and old people, under the authority of the Minister of Labor and Social Affairs Development, we have 9 ministries within this committee, in addition to representations of the civil society association. This commission is reviewing all the legislation, all the activities, all the specific programs in each individual sector. We also have the second strategy of Qatar for the period 2018-2020. It is a strategy for social protection, where different ministries participate. Of course, my ministry, in addition to the associations of the civil society, we exchange experience, and one of the parties is in charge of the program. It's either the ministry or the associations that choose a given topic to manage it.
مشاريع كثيرة بالإضافة إلى وزارة التنمية الإدارية والعمل والشؤون الاجتماعية بالإضافة إلى أن فعلا يعني هناك تعاون كبير بين مؤسسات قطر
between the different associations within Qatar, including the Association for Social Affairs. We've signed an MOU to work hand in hand. We also work with the Doha Center of Family. The purpose of all this common action is to reach positive results. 2 weeks ago, more or less, a new legislation was adopted, that of associations. It's a new law on associations, and we do hope that we will have more associations and private organizations in charge of the child in our country in the future. Thank you for your attention. Thank you to you, Madam. We'll get back to you for more questions later on.
Hamilton, where is acceleration still needed to end violence against children? Professor Hamilton? Yes, Professor Hamilton, I'm asking you, what can we accelerate action to end violence against children? We seem to have a problem. Maybe I will address the question to Mr. Aguilar.
Yes, I'm ready. I can hear you.
Okay, what kind of acceleration is still needed to end violence against children?
Well, maybe the most important at this stage is to, I think I will go back to what Mrs. Mariam highlighted already. You know, sometimes we come with very complex ideas, and at the end, I think she's summarizing the most beautiful terms what we are trying to do. The first step is to really have those services that can help families. When we observe violence in the family environment, we need to offer solutions to those families. And to a great extent, there are a few services available across countries. How do we bridge the gap, this trust gap between communities, families, and service providers? I think this is the $1 billion question. And it's not enough to have services available. It's how do we reach out to communities to request those services. So that would be a first important step. The second one is that we tend to perceive, and I'm going back to what the SRSG already highlighted, we tend to see children as passive victims, but the most we give them space to speak out, the most we give them space to participate in the community, schools, in our own families, the most we are likely to make that change. And the third accelerator, I'm just summarizing what other panelists have already mentioned, is that we definitely need to do something around how we raise boys and definitely girls But I'm mentioning boys in particular because it is well known that there are intersecting forms of violence. Sorry for the jargon, but this is the violence that happens against women and the violence that happens against children. There is some overlapping, and there is a lot of evidence about that. I think if we want to make a major change is what is this idea of masculinity we want to inculcate in the new generation of boys. That would be transformative. Definitely girls along with it. But there is a lot to do in terms of how us men, we are raised, how do we contribute to families and society, and there is a kind of silence around that. And probably the fourth accelerator, I would say, is we are in that desperate need of champions. Champions such as, I can see that Qatar has been leading in many topics from education to disabilities, and that type of international leadership, that convening role of some government is really catalytic. A few years back, it was impossible to have this type of conversation because we were considered not important. Child protection violence was considered like it's a second topic. It's not important. So we need, as an accelerator, leadership and really champions that make us, connect the different countries in the region. And I'm hopeful that in the years to come, we will create a broader and sustainable cooperation in the Arab region. We have a lot to learn across the region, from North Africa to the Middle East. Many new practices emerge. And so I would say if we are able to bring all this knowledge in the Arab region and to really learn from each other, that would definitely be an accelerator. Thanks.
Each of you, my dear panelists, your concluding thoughts briefly. I will start with you, Professor Hamilton.
I'd like to just go back.
You need to unmute your teams.
I have unmuted. Can you hear me? Yes. I'd like to go back
we
and
can
just
hear you
pick
perfectly now.
I'd like to go back and pick up a couple of issues that were raised. One I thought was really interesting was the recognition of violence. In some ways, that's a positive, and in some ways, it's a negative. It's a positive that governments have started to understand and communities have started to understand that actually violence is widespread in families and in schools. On the other hand, in an unnamed country in the region where we did some research, which showed high levels of physical and sexual abuse, we were asked to remove all the sexual abuse statistics. It was not acceptable to put that into the report. Not that it wasn't happening, but they didn't want public recognition that it was happening or public information. And I think that's very important because denial is not going to stop the problem. So the recognition issue goes one way and the other. I think breaking the cycle, which was raised, is also very interesting. Yes, definitely we need to address the behavior of boys as we bring them up, but also we need to look at child-to-child violence. And there are some very good programs and practices now in schools where they really work on children's behavior and children's way of relating to each other and how to manage difficult situations, not to respond with violence, but to use much more positive ways of sorting out issues. Then there are issues like coordination. In one country where we were working, there's a really good program in schools on positive discipline, which reduced violence in schools significantly from teachers to pupils. And the pupils went home and talked about this, but the parents were not receiving the positive parenting at the same time and were coming back and complaining to the teachers about how their parents behaved and how they clearly didn't understood. So wouldn't it have been good to have had both the parenting program and the positive discipline program in schools running at the same time? But I think there's also, if I may make one last comment, there are issues that we can't ignore. Issues like mental health, alcoholism, drug use, poverty. These are all factors and drivers of violence. And if we are going to really eliminate violence against children, we need good programs that will address those issues as well, particularly mental health programs, both for the adults and for the children. So I think there's a whole range of issues. It is complex. It's not unresolvable, but it's complex. And I agree very much about the awareness raising, particularly through very popular TV programs, soap operas, that you can address the use of violence very effectively through popular media programs.
We should change also a lot of narratives passed through popular TV programs that allow stereotyping and bullying and so many negative messages. We need to address all those definitely. Dr. Ma'allam Jid, your concluding thoughts before we move to Q&As.
Okay, I will be very short. I think because many things were told, I just want to tell that we need to use the COVID-19 as an opportunity, even I am not enjoying this word, to make sure that child protection services, as we understood it, including all, protection, health, mental health, education, justice, social protection, working with parents, working with the system, involving children and making sure that children are at the center, really are part of the socio-economic recovery plan. Just I want to remind you that currently worldwide, all the states are designing their socio-economic recovery plan. And this is really important. The other point, it's not only about designing. We have to make sure that the budget and the resources are duly really allocated. And when we are speaking about resources, is budget resources, but also social workforce, based on quality. This is important. And when I am speaking about social workforce, it's all the front line. And I just want to tell in a practical way, what does it mean? We don't need to delay what we did. I think it's an opportunity also to assess what is existing and to see what are the context specificities, what are the risk factors, what are the protective factors, what is working, and to scale up what is existing and to tackle the challenge. And my last point is about coordination. This word makes me a little bit having many concerns. We are asking to act together. Coordinating and acting together, it means having clear responsibilities. Who is doing what? And clear accountability mechanism. And my last point, children, really, I work with them, and all of you has to be seen as part of solution. And they are really positive actors of change. Over to you, Rawa.
Mr. Aguilar, if you have concluding thoughts, you can add it to the answer to one of the Q&As that came directly to you, whereas the question is about Qatar. The question is, what can Qatar do to strengthen its child protection systems, including the most vulnerable children with disabilities who are often forgotten?
This is a question for me, sorry, yeah? Yeah, okay, so maybe there is already...
coming from the audience.
Very good. I'm aware that it's already happening in terms of legislation and enhancing social workers. If there is something that maybe it's important to take into account is whatever we do, we need to look into at least two things that are coming together. We have to aim at behavioral change and not only a provision of services. Whatever we can do through social workers, education, it is a really specialized area of work to try to look into how do we contribute to promote positive behaviors among children, parents, teachers, community. And the tradition has been that in many countries, and probably it can apply to Qatar to some extent, is that we think that the provision of services will be the solution. Going back to what Mariam said just a few minutes back, I think that's the point. You have the most perfect services available, but there is still something missing. And this element is about the behavior and recognizing that we need help, that also we can help others. So that would be the first thing I would say. The second is that we definitely need as well, for the few things I know about Qatar, is a specialized workforce that is capable of dealing with the most serious cases, including sexual violence. There are some forms of violence that are easy to recognize and accept, and we are able to talk, but as the SRG mentioned, we are a little bit, no, I think, Caroline, we're a little bit more scared of talking about sexual violence. The most we have this specialized social service workforce capable of helping families, I think that can be a breakthrough as well. Thank you.
Ms. Al-Misnad, this takes me to a question coming. Many panelists mentioned importance of strengthening the social service workforce and strengthening the child protection system, just like Mr. Aguilar said. What does this really mean concretely, and why is it so important?
I think that it's really important to strengthen the system and also to raise the skills of the social workers who works with children. As I said before, if a child does not trust the person that he goes to report to or work with him, I don't think that it will be a successful journey for the child, neither for the family. But I think also that we should focus on having our civil society and the governmental entities being more proactive than reactive, because we tend to be reacting towards problems that happens every day, and we solve the problems that comes to us, let's say, on day-to-day basis. But when it comes to being proactive and collecting data and knowing exactly what is the cause, what is causing violence. Mr. Carlos just mentioned something that is very important. The way that our boys are raised, especially here in the Gulf, I think that we need to stand back and look at it. Are we doing it right? Do we think that we need more parenting programs? Is the problem? Does the problem start back at home? Does it start with the family? Who creates the problem? Does it go back to substance abuse, just as Ms. Caroline said, or other factors? So I think that we need to first understand what is causing violence, work on being proactive plus being reactive, of course. Do some training programs for those who work with children, such as social workers, psychiatrists, and psychologists who works on daily basis with children. Also, I think we have to come up with the right solutions according to. I cannot say that this solution will work in Qatar and it will work elsewhere in the world. I think that every society has its own, let's say, way of solving the problems according to the norms and social services that they have.
سيدة عبد الله، ما أهمية تعزيز القوة العاملة في مجال الرعاية الاجتماعية، سواء من معالجين نفسيين، أخصائيين، وحتى تعزيز
psychologists or social workers at this? What is the role of families in this connection? This is very important. And it is very important to solve any problem, the present one and the future problems. The ministry is setting up an integrated program in cooperation with UNICEF, with education, mental and social workers specialists. We are preparing integrated workshops which would train specialized social workers, particularly in the parenting skills. This would ensure a logical and a common path. We need integrated projects and programs, and hopefully we will be able to free our world, and particularly the child's world, from violence. How can we empower
children around the world to be able to safeguard themselves from the different forms of violence?
Yes, I think first we need to inform them. And when we are speaking about information, that we allow them to have access to an information that is easily understandable, that also is adapted to disabled children, and to make sure and the age and so on. This is very important. The other point is also listening to them and providing, space and channels that protects themselves, and in the same time being able to speak if really manner, and in confidential manner if it's needed. And the third point, what is important is to start consulting them, when we are designing program, when we are assessing program, when we are implementing, to see them not only as beneficiary, but also to take into account their views and how they could be more and more involved. And the main other point is to make sure that they are involved, in also the monitoring and implementation. Empowering children, making them more strong to protect themselves and protect the other, to raise awareness, to drive change. It's a long and sustainable process. We have to stop the exhibit show to make sure also that the representativity, and here I am speaking from our region, the representativity of children include all the vulnerable children. It's not only about because you are the best child in school that you have to be, to make sure that we have this representativity, because they have a lot to tell. And it's really important when we are really taking into account their view, restituting to them, and also in the meantime, making sure really that their views are taken into account, and to have this dialogue. Just I want to let you know that currently we need to do it. Why? Because children, more and more younger, are using their own channels. They are not waiting to be supported. And we see that they are using social media to express, sometimes in good way, sometimes in bad way. We see more and more children being part of social unrest. And I think it's important. We need to listen to them and to stop speaking about children, our future children, هو المستقبل. I think they are existing now and they have to be part of it. Over to you.
Empowering them is not dropping all the responsibility on them. It's actually including them in a more collaborative approach from everyone. Professor Hamilton, is there a correlation between different types of violence, example, mental health and other effects? Are there any international accessible guidelines on it? You need to unmute your teams.
In terms of child protection, yes, I mean, there are guidelines from the World Health Organization, there are guidelines from UNICEF. It's difficult, though, because a lot of these factors cluster together. So you'll find that there are a whole range of circumstances. And I think one of the other things that's quite important to say is we've been talking about eliminating violence for all children. And for most children, that violence, if it occurs, will not be serious violence. Upsetting, but not necessarily serious that has an impact on them long term. But for a certain group of children who are really vulnerable and very much at risk, we do need those specialized services that can really intervene and respond to the violence. And it's important that that element is put in place in every state, as well as, the more broad public awareness programs, peer-to-peer programs, general health and education programs.
There's another question. Is there a centralized database or mechanism to track violence against children at home?
I think Javier is the best one to reply to that, because there is a UNICEF database.
Right. Thanks a lot for the question. Maybe a couple of answers to this question. The first source of information is you have surveys that are done at country level. In the Middle East and North Africa, you have the demographic health surveys that give you information about the prevalence of violence, but those are more superficial surveys. The most important, the most really useful type of information is that what we call in our jargon administrative data. So the main source of information here is the child lines. We have at least 15 child lines in our region. where people report incidents of violence against children. So this is a very valuable source of information telling you the trends. There is a lot of missing information. And then you have more specialized surveys that look into the type of violence that is affecting children, including sexual violence, situations of armed conflict, and beyond. So it's partial. The takeaway here is that it's largely insufficient to understand the magnitude of the problem on a real-time basis.
Thank you, Professor Carlos Javier Aguilar from UNICEF. Thank you, Dr. Najat Maallamjid, the United Nations Special Representative of the Secretary General on Violence Against Children. Professor Dame Caroline Hamilton from the International Programs and Research at Quorum Children's Legal Center. Mrs. Najat Abdullah from the Ministry of Social Affairs in Qatar. And Mariam Al-Misnad, the Executive Director of DREAMA and Aman Centers of Qatar Social Work Forum. Thank you, everyone. I really hope the messages sent here today resonate and that this will be the last year we ever talk about children, violence against children, but maybe not before 10 years. Next up, we go back to Luisa Baldini in our London studio for the keynote speech. To you, Luisa.